Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has had a cut, which your doctor has assessed to require tissue glue or, for wounds on the scalp, hair apposition technique. We have put together this video to help you understand more about how to care for your child's wound after it has been glued. In this video, we'll talk about what tissue glue is, how to look after the wound at home, and when you should seek medical assistance. We use tissue glue for certain wounds to keep the edges of the skin together to facilitate wound healing. We can use it for superficial wounds up to 5 centimeters in length, which have non-jagged edges and are not actively bleeding. We cannot use it for wounds under tension or wounds that are near movable areas, such as the chin or near joints. A dry scab will form over the wound, and this will flake off as healing takes place. For wounds on the scalp, we can also use Hair Apposition Technique, or HAT. A few strands of hair on either side of the wound are grasped and crossed together, and a drop of glue is applied where the strands cross to secure the wound. There are 3 aspects to looking after your child's wound at home: general wound care, care around water, and administering medications. After gluing, a dry scab will form over the wound. Ensure that your child does not rub, scratch, or pick at this scab. It will flake off slowly as healing takes place. The wound is water resistant but should be kept clean and dry. There is no need to cover the wound. After a week, you may apply an oil-based product such as baby oil to soften the scab daily until it is completely removed. 24 hours after the gluing procedure, your child may have a light shower. Although the wound is water resistant, avoid immersing the wound in water for long periods. Also, avoid putting shampoo directly on the wound. After showers, pat the wound dry. You should avoid swimming for 4 weeks after the procedure. Your child may need some simple pain relief, such as paracetamol, in the first couple of days following an injury. Your doctor may also prescribe antibiotics to prevent infection of the wound. Complete the course of oral antibiotics as prescribed. You should see a doctor if your child develops any of the following conditions: a fever of 38 degrees or higher, if the wound splits or gapes open, if you notice excessive discharge or bleeding from the wound, if the wound becomes red, swollen, or warm to touch, if your child has severe pain not relieved by the pain medications, or if your child has any abnormal or prolonged symptoms which cause you concern. Key points to remember are: tissue glue can be used for certain wounds in place of stitches. There will be a scab that forms over the wound after the gluing procedure. Do not pick at or remove this dry scab. 24 hours after the procedure, your child can have a light shower, but you should avoid immersing the wound in water. After a week, you may apply an oil-based product, such as baby oil, to soften the scab until it is completely removed. If you notice that your child has any of the warning signs explained earlier, bring your child to see a doctor. We hope you feel more confident in looking after your child's wound after watching this video. Do also refer to the pamphlet given for further details.